Okay, hey, my name is Mary Ezel, and I'm a physical therapist with ATI Physical Therapy. I first began interested in occupational therapy and physical therapy through a career fair when I was in middle school. So much like you guys, you're learning about different careers and investigating. And when I discovered that physical therapy and occupational therapy had to do with helping people, and I got really excited. So I started volunteering in a hospital when I was in high school, and then I also started volunteering in a physical therapy clinic where they also had occupational therapists and speech therapists. And after seeing those three disciplines, it really helped me to distinguish the differences between them and helped me to firm up my decision to pursue a career in physical therapy. While I was an undergrad, I also volunteered in a school system and helped a physical therapist that worked with elementary and middle school students. Things were done a little bit different when I was graduating from school, but how it works now is that after completing an undergraduate degree, which usually takes 4 years, and completing prerequisites for getting into physical therapy school, you apply for a physical therapy school, and once you're accepted, it takes approximately 3 years to complete. You come out with an entry-level doctorate in physical therapy. Although physical therapists graduate with a doctorate degree, most are called by their first name and are not referred to as Dr. So-and-so. I always thought that since I was a college athlete that I would pursue a career in physical therapy related to sports teams or work with a majority of athletic people. But it turns out that I have a real soft spot for folks that are undernoticed and geriatric or elderly. So if you have dreams of the flair of working with NFL players or listening to the heart of an elderly person, physical therapy could really be a great fit. I'm outside. I had a bit of a hiatus from traditional physical therapy for a few years, but my love for helping people combined with my love for Christian mission work led me to live in Central America for a number of years, and I helped to set up free health clinics and host mission teams. And without a degree in healthcare, I probably wouldn't have been able to do that. So I'm very thankful for a career in physical therapy. It was a real dream come true for me to combine faith and work. You never know where your life will turn out. You may be wondering what an average day looks like for me. Well, I work about 40 hours a week, and I usually have to do a little bit of paperwork to document on patient files after hours. That's probably the biggest bummer about working as a PT, the paperwork. But the thing I love most is the personal one-on-one time that I get to spend making a difference in someone's life. So as a physical therapist in an outpatient clinic, I work with orthopedic diagnoses like shoulder and neck and back and knee pain. And we see them post-surgically or pre-surgically, or we try to keep them out of surgery by getting to them before they get really bad. I also specifically work with post-concussion patients and help get them back to school, their sport, or their job. Other diagnoses that I work with in particular are neurological conditions such as multiple sclerosis, Parkinson's disease, and stroke. In these cases, I get to help people restore their ability to walk again, and in some cases, help them to get out of a wheelchair. It's pretty cool. And just looking at job outlook and how things are looking long term, as people are living longer and baby boomers are growing older and extreme sports are becoming more popular, the job outlook and need for physical therapists is very promising. My advice to you would be to volunteer or get paid in a position as a rehab tech or an aide in a clinic to get hands-on experience before deciding what direction to go in. You'll realize whether you like it or not. I don't know if you're like me, but I've had a tendency to have difficulty making big decisions. And I really wanted to pick the right career or the best option. So I would say it was really helpful for me to see how things worked in real life before making a decision on what major to choose. So if you like math and science and enjoy helping people, especially in a smaller setting like one-on-one, and you don't mind pushing someone through pain when you know in the end it will be worth it and they will accomplish your goals and they'll thank you for it, then I think physical therapy might be a good career option for you.